try to share stories to give people a sense of like what that actually means. And we're so excited for our storytelling event today. And just to briefly say what we think academic entrepreneurship is, it's this intentional focus on translating science and technology developed in our academic setting into impact via commercialization. And my real world experience of this is like whenever I go to any doctor's office as a patient, as a physician, I look around and all of this stuff like was bought by the institution, right? So it's not like it got made in someone's lab and it's directly going into a patient or anything like that. Everything kind of goes out before it comes in. So what are the things that we need to be thinking about as we do our science or whatever roles we're going to play along this path of discovery to solution to ultimately healthcare impact? And I think that's the thing that unites us. So without further ado, I am going to hand it over to our panelists today. We have Angie Ellison, Sharon Irving, and Subha Airan-Javia. I'm really excited to have each of them tell a little bit more about their stories with you. And I will just say, I think each of them like really represents the interesting paths one might take as you kind of attempt to integrate academic entrepreneurship into your career paths in different ways. And that doesn't always mean leaving academia. So with that, I will turn, we have some, you have the their bios that were provided on a paper and also electronically, and then we'll put up some slides as each of them is kind of sharing briefly their story. So with that, Angie.
All right. So thank you so much for having me. I know I have a mask, so I'm going to speak loudly. Hope everyone can hear me both here in the room and at home. So I was born and raised here in Philadelphia, and I decided to become a pediatrician because I have a sister who has sickle cell disease. She's 10 years younger than I am, and so my whole career goal was to have an impact on that disease. I finished college in 1993. Don't do the math to try to figure out how old I am. But, I started my career actually working just across the river at Campbell's Soup Company in the research and development department. And I knew from that experience that I definitely wanted to go to medical school, but I learned a lot about processing and why it is important, even in a can. I worked with coatings and cans, why it's important to not only develop and think about different ways in which you can use compounds to both protect the food that you have, but also save money. So if you save 1 cent on 1 can of Campbell's soup, save a lot of money because there are millions of cans around. So after that, I earned my MD at Johns Hopkins in 1998, and then I went on to fellowship where I ended up completing a pediatric emergency medicine and general academic peds fellowship. Part of the reason I did emergency medicine is, although I wanted to have impact on sickle cell disease, I had to figure out how I was going to do that in the ED because that was my passion, and I discovered that during my residency. And general academic peds because that was part of my way towards research at that time. There was a person there, I networked with them, and they had a T32, and I said, okay, I'll do extra years to get this training. In 2005, I earned the MSc degree, Master's in Epidemiology. That was not my plan when I started fellowship, but you should see I just kept extending and doing different things until I ended up back here at CHOP in 2005, and I finally was appointed a faculty member in 2007. I went on in 2009, after a couple of tries, got my first NIH Care Award, and then later I actually served as a site PI on an industry-sponsored study, sickle cell disease. So that was my kind of venturing outside of my safe space. I also tried to work on my leadership skills. So I spent some time also as Associate Director and Director of Research in the Division of Emergency Medicine. And part of my background and my passion is really in trying to diversify academic medicine. And I believe very strongly in being a mentor and help bring in those who are behind me forward. So in 2017, in my role as Chair for Diversity and Equity, I started a summer scholars program with underrepresented students from medical schools across the U.S. will come here and spend 8 weeks. In fact, they're just starting their 6th cohort this morning. I was downstairs or over at the hub greeting them, so it's perfect time. And later, I became the vice chair in the Department of Peds. And then during that time, I co-founded what's called the Leadership Accountability Team with Dr. Nicole Washington, where part of our goal is to make sure that we retain underrepresented minorities in academic medicine by serving as a source of support and providing bi-directional navigation skills to both leaders and the faculty as a way of moving them forward. Later on, I became a consultant. I think that's my venture out into entrepreneurship a little bit. I am very much committed to, as I said, diversity, but also advancing health equity. So I serve as a consultant to a project ran by the AAP, the American Academy of Pediatrics, that's looking to eliminate race-based medicine. And I can tell you through this project, it was so great because we are allowed to just use our imagination to think about how we look at policies, written clinical guidelines, and trying to develop methodology for that everyone can use, not just us at the AAP, but everyone can use to figure out if policies and such are problematic in their use of race in their description. And finally, I was recently elected to the AAP Board of Directors, and that's really important for me because that's a way in which I can do my advocacy outside the walls of CHUC and really try to have impact on a larger group of people. So that is my story.
Well, hi, everybody. My name's Sharon Irving, and I'm a nurse. How many nurses are in here? One. I'm a nurse. Recently, somebody described me as a nurse who's often in places where there are not nurses. So, yet again.
I have to say, I don't know, we had a lot of people registered for the event, and I was so pleasantly surprised by the diversity of like the roles that people play, because I think, you know, I'll just even say the three of you are also clinicians, and we have also so many people who are doing other roles, like not necessarily providing direct clinical care.
So yes, I'm a nurse. Let me see where she started. Yes, okay. Like Angie, don't do the math. Okay. But I went to nursing school because it was an easy thing to do at the time. Nurses were getting jobs. Other people were not. I was like, okay, I can go do that. I can do that. I'm not doing it with adults because adults don't know how to follow directions and they're too big in the bed. So I've always done pediatrics, neonatal, and pediatrics. And then along the way, I'll just say along the way, I have never been one to, even with my parents, I was not the one that followed directions, right? So when I got to nursing, and started out in a NICU, and they would say, do this, and I'd be like, but that doesn't make sense. No, but that's what we do, but it doesn't make sense. So I couldn't just do it, and so I was always that one kind of stepping outside. Angie's nodding her head, because
that's why we get along.
I was always stepping outside and pushing myself, and so along the way with doing that, when I was still at Georgetown, I became an instructor for the neonatal nurse practitioner program. I'm not a neonatal nurse practitioner, but I knew how to take care of babies. And so part of my journey was like saying, if you're going to do this, you got to do it right. Okay. And so that pushed me along so how do I get to what it is I want to do? So I did NICU for a long time. And then I decided that I wanted to take care of patients that should talk back to me, that I could interact with a little bit. So I went to the pediatric ICU, whole new world. But again, I wanted to do things right. And so I had to do my own learning because I was definitely in an area where I didn't see anybody that looked like me. And I was often pushed to the back, like, oh, she doesn't know how to do that. So I had to advocate for myself. I had to be the one to say, no, you're not going to give me this feeder and grower again. I'm going to take care of this patient on the ventilator because I can tell you what this blood gas means, and I can tell you. So I had to do a lot of those things myself because in a pediatric ICU, in a large academic institution that was not CHOP, I was not here as a bedside nurse, there was often not opportunities or not, I would say, doors open to the nurses that were minorities, the nurses who would speak up for themselves. We were often pushed to the back, right? So I really had to push. At the time, if somebody had said to me, those are leadership skills, I'd be like, no, those are survival skills. Because that's what I'm doing. I'm just trying to survive because I want to be the best that I can be at doing this, right? Didn't know along the way that I was building leadership skills. I was just doing what I thought was right. So that takes us all the way up to, let's see, 2001, 2004. In there, I was at University of Maryland for a period of time, and a community-based program along with one of the supermarkets, and I want to say it was Kroger, but don't quote me on that, put together money, and we started what was called a Breathmobile. And so it was a community-based RV that we went around to schools in the Baltimore City school program to treat kids with asthma. I was the nurse practitioner. Nobody had ever done this before. Nobody knew what they were doing, including me. And they put me on this RV with a stack of medical records, if you will, to fill out. I was like, no, you're going to get me a laptop at least, and so that we can do things and, again, do it right. And so here I was in these schools taking care of these kids with asthma who, managing their illness was not their family priority because we were in, inner city Baltimore. And if you know anything about East or West Side Baltimore, it is truly inner city. So managing their asthma was not the height of their focus for their families. It was about, do I keep the lights on? How do I make sure I get my kid to and from school safely? Because there was just a shooting on the corner last night. Those kinds of things. So again, building skills that I didn't even know I was building at the time, just trying to make sure I kept my kids out of the emergency department and out of the ICU. Because I was affiliated with University of Maryland, and at that point was a nurse practitioner, if they got admitted, I had the opportunity to go into the hospital and help take care of them. So some continuity of care there. And then I decided I wanted to be a leader. And so I was going to go take this job as a director of nurse practitioners in another large academic institution. Wrong answer. For me, that was the wrong answer, because that meant I had to be in this box, if you will, and listen to rules that other people made that didn't make sense to me in terms of how to take care of these children. So I didn't last there very long in that role, for about a year. But during that time, I got really interested in research because I realized as a nurse practitioner, every day I go to work, that's what I'm doing, is some research, right? I got to figure out what has happened to my patient the night before, the day before, the week before, and be able to put that together to take care of them. And so that, for me, was really how I started on my research component of my journey, as I was trying to, again, be the best that I could be in terms of being a nurse practitioner. So at that point, I got recruited up here to Penn Nursing to be program director or program manager of an NIH study. I had no clue what any of that was. But I came and I said, okay, I can do this. And so I just spent time and asked questions and did things like this so that I could learn how to do it. Again, building skills that at the time people were like, you are such a leader. No, I'm just trying to do my job, But it was beginning to churn in my head at that point that maybe I do have some leadership skills and maybe there are some things that I could move forward. During all of that time, my interest from a research standpoint and patient care standpoint has always been nutrition, right? Because it didn't make sense to me when I was a bedside nurse that we would have infants and children hospitalized for 3, 4, 5, 6, 7 days on IV fluid. I'm like, their whole job is to grow. So why are we not feeding them in some kind of way? So I became very, very interested in nutrition in acute and critically ill children. And that put me on a path of how do you deliver nutrition, right? Because they clearly are not going to sit up and eat it. right? They're intubated. So then that took me down the path of really learning more about nasogastric tubes and gastric tubes and IV nutrition, so on and so forth, which brings me to, during all of that work, I finished my PhD in 2011. And yes, I worked full time. And yes, I did my PhD at the same time. I was a little crazy, yes. But I did it because I didn't have the option to just live on a stipend, right? So I had to work and I just did it. You just put your head down and you do it. And you work more in the summer when school's not in and, you make it work. And then once I finished my PhD in 2011, in 2012, I came on faculty at Penn Nursing. And that's when it hit me that maybe I had some leadership skills, right? Because now I also recognize my responsibility as a Black woman in nursing at an IVD to show others that they could do the same thing. That's when it really began to hit me. And that's when, in doing the research that I was doing at CHOP and bringing these children from the cardiac ICU, you can imagine dealing with the cardiologist and the cardiac surgeons to say, I'm going to do these things on your children because I want to ensure that they are getting good nutrition and how we feed them, that I had to advocate again for myself and actually convince them that those kids were safe with me. Because in some instances, I was taking them off the unit to the feeding and growth lab, and that's where I met Mary Sizer, who's sitting there, in the feeding and growth lab, because I wanted to get the right people doing measurements on them, the right people doing the right things with them. And so that was not the nurse at the bedside, and I knew that. And the grant that I was working on, we had the opportunity to take them down to the nutrition and growth lab, where they could be measured by people trained to do these measurements. Again, recognizing the responsibility that I now had to demonstrate that I knew what I was talking about, that I could take care of these children, and that there was this niche for me in nutrition in critically ill infants and children. That's how I got there. So how I met this group of people is because with that, when you put down nasogastric tubes, there are all kinds of problems that can happen. And once you get it in, it can get clogged. Well, you don't want to keep putting it down if you don't have to. So through some other colleagues and such, I connected with a company that makes a device called Tube Clear to clear the tubes. Nobody had done it in children. Here I am again, the nurse in a space where there had not been nurses, but I knew better than any of the other people that we gathered on the team of how the delivery of nutrition worked using those tubes. And so spent a lot of time with them going back and forth about, nope, that is too stiff. It's going to puncture the tube and cause perforation. No, that's too big because we have tubes that are 6 French. And these were all things that none of the other people in the room really had thought about. But this is what I did all day for years now. And so that's what got me into that. I'm doing that work and continuing the work that I have done over the years in nutrition and critically ill children, and really peeling back the onion, right? Has gotten me, and I've been fortunate enough to work with colleagues across disciplines, and I'm now fellow in the American Academy of Nursing in critical care medicine and in the American Society for Parental and Children. And then I guess 2020, I became an associate professor, and July 1, I'm a full professor. And I have just been elected vice president of the American Society for Parental and Enteral Nutrition. So an opportunity, similar to what you were saying, to take this to a larger scale. I am very proud to say I'm the first nurse practitioner, and first person of color to be vice president of that organization. So that's my story and sticking to me.
Wow, that was awesome. Before I start, I feel like there are just some themes that, if you'll permit me, I just want to share, and they're going to be very freeform because I'm not taking notes, so they're like in my head. But, and you'll see this with me, and I'm sure with many of you as well, is that, we all are following what we think is right. and our passion for what we think is right. And along the way, we find problems that need to be fixed. And so we're like, we're going to fix them because I think at its core, and this is something I learned deeply from my parents, is do not accept the status quo. Because if that status quo is not right, then it needs to be changed. And it takes people with passion and people willing to take the risk to step out of their comfort zone to try to make that change. And I think you'll also find that none of us are in a position now that we ever thought we would be in when we started. And so a big part of just our careers is being open to change and being open to new opportunities, or things that might seem like challenges or doors closing, which really end up being opportunities for change and doing something new that you would have never thought you would do. So I just think it's great to see these commonalities across different settings. The other one I'll say is imposter syndrome is real. I am having it right this moment after listening to both of you. And it's one of the things I wanted to say for later of how I deal with just many of the situations I'm in as me, but also as a minority in business oftentimes, and just calling it out and saying it has helped me personally so much to say, okay, it's imposter syndrome. It's imposter. Doesn't mean you can't be here. It doesn't mean you shouldn't be here. It just means you have to own it like all the white men own it, and I'm just going to own it. So you both are amazing. Okay, so my name is Subha. I grew up in Miami, so very far from Philadelphia. I've slowly made my way up the East Coast. So I'm a Tar Heel, go Heels, where I went for undergrad. I was in Maryland for med school. And then I came to Penn for my internal medicine residency. Up until that point, it was kind of straight path of I want to be a doctor. My why really started because I fell in love with biology and the nephron, go figure, in biology class in high school. And during my internship, I was really struck by how inefficient things were when we would practice medicine and how easy it was to make mistakes. So I think like most interns, I was like, oh my God, the last thing I want to do is hurt someone. I just want to provide good care. And fortunately, I had good teachers who were also very attuned to mistakes that can happen in medicine and saying, how can we prevent them? And so I started to see everything from that lens of, oh, this is something that was either an error or a near miss that could have been prevented had we been doing something in a different way. So I got really interested in just process improvement. And I've always been a technology-focused person. So I'm always interested in how technology can interface with our daily lives and what we do. So at the end of and I came into medicine saying 100% I'm going to do a procedural specialty. I will not be a generalist. I'm a hospitalist. And I'm also a clinical informaticist like Daria. But I lost my train of thought. All right, so I'm into technology. And at the time, we were using Word documents stored on one computer to do our handoffs in the hospital. It was our handoffs, but also our daily list, our work list. It's really like how we manage what we need to do as a team to take care of a patient. And it was just so error prone and inefficient. So at the end of my intern year, I went to my program director and I said, this doesn't work. We need to make it better. Will you please help me get resources to make a better system? And she, I'll stop to say that mentorship is hugely important in having people who help you kind of get to those first steps of your dreams, or really, such an impactful, or they're catalysts to where you want to go. So she was one of them. So she believed in me and what I was saying and helped get resources within the Penn IT department for me to work with to create a system. So during my second year of residency, we created a new platform at Penn that we used for our handoffs, which about 4 or 5 different residency programs at Penn used. And that was this like real aha moment for me, where I realized that my ability to improve care was exponentially greater through systems improvement and technology than it was through direct patient care. And that was intoxicating to me. So like, wow, I can really have such a huge impact this way. And so through continued mentorship with my program director and those experiences, I decided to not pursue a clinical fellowship and instead to pursue informatics. At the time, an informatics fellowship wasn't really a thing. CMIOs weren't a thing, like it was very new. So I basically, once I decided not to do, and I was tied here due to my husband who was a resident, I just didn't want to be apart. So I was like, I'm just going to figure out what I can do here in Philadelphia. So I literally went to every CMO in our health system with a list of ideas of how I thought we can make our IT systems better. And I said, you need to hire me to be your liaison between the clinicians and the IT department so that we can have better systems and we can provide better care. So essentially convince them to make a role that didn't exist around being this physician liaison. There wasn't even a title. That's another, I think, teachable point, which is that I didn't care about titles. And I learned later, particularly as a minority, that unfortunately titles are important because it just lends credence to what you say, and it lets you have a seat at many tables that otherwise people would forget to invite you to. And it took me time to realize that, no, I really should advocate for myself to have a title in this role because otherwise no one's going to realize that I should be there. So I started off for a long time with this lack of title called physician advisor to the IT department. I joined faculty at Penn as a hospitalist. So I started off doing 50-50, 50% clinical, 50% IT. And I essentially became, in that role, I eventually became the associate CMIO for Penn Medicine. And my focus was inpatient technology and the design and implementation of that. So anything that would touch providers, clinicians, all clinicians on the inpatient side, whether it was order entry or anything, I would kind of review it, have a say in it, and help design it. I also did some work around, hands-off education, IT education for residents. I realized along the way that we teach people how to practice medicine and we teach people the physiology behind medicine, but we don't teach them how to operationally deliver care, which is very impacted by our systems and our technology. So that's a lot of what I've started teaching about is, okay, the medicine about how to treat this disease. How do you actually implement that plan in a clinical setting effectively so that, your patient gets the best experience and you actually get the outcomes you're looking for. And then, so along those 10 years as associate CMIO, I continued to work on this handoff platform that we created at Penn, and ultimately built a platform called CareAlign, which is the inpatient workflow and handoff tool used across the Penn side of the health system, or I should say the Penn health system. And that was like a really incredible experience. So literally the entire inpatient world of Penn Medicine uses this application that I led building. And we talk about entrepreneurship. To me, that was entrepreneurship. So taking this idea and designing and implementing it across the health system. It's still in use today, so it's been in use for about 10 years. And there's a lot we can talk about around, how even what you initially think is a solution and is the problem you're solving for, it ends up being something very different. So for me, it started off as we just need a better handoff tool. And what I realized is actually teamwork is broken in medicine. And this platform that I built is really around, how do we improve teamwork and how do we help us work effectively around a common goal, which is our patient's health. So after we first implemented this around 2014, I would speak about it at conferences. I would share our research about designing technology that clinicians actually liked using. Go figure, it's rare. And I would be at conferences and people would say, how do I get this? How can I bring this to my health system? And I realized that I knew nothing about how to get it to them. I would say to Penn, you should go give this to other places. I realized that wasn't actually possible. I knew nothing about business, and what I learned was that if I wanted to take our invention and bring it to other organizations, the main path forward was to do it as a business. So, and I'll come back to how I think there are actually other ways to do that, but the way we did it was I spun out a startup from Penn, which I ran for about 6 years. I truly was looking up every other word in every conversation on Google while I was in conversation, be like, what is runway? What is equity? What is capital? I didn't know what any of these things were, but I still jumped in and did it, and made a lot of mistakes along the way. But we ran that startup for about 6 years, and really focused on. I realized a lot of what we needed to do was just education and teaching people about the problem that we were working to solve and why we even need something better. To be honest, a lot of times I feel like I'm trying to convince people they need cars when they're really perfectly happy with horses and new saddles. That is a whole thing in and of itself, which I won't spend a lot of time on, but we can talk about. But what I'm doing now is we've just started a new nonprofit called Catherine Gives, and my why is that I had a sister who suffered with mental illness her entire life, and then unfortunately had an accidental overdose a few years ago. And my personal way through medicine of dealing with her disease was to ignore it. So I did nothing to do with psych, nothing to do with anything related to mental or behavioral health or substance use. And after she passed, I realized that I wanted to do something to contribute more into this space. So the nonprofit's called Catherine Gives. Her name was Catherine. And it actually still melds my passions with what I was doing before. And it's just starting. But we are essentially taking the same teamwork platform that we built and implemented at Penn. And the goal is to work with community-based organizations in geographic areas, so let's say all of Philadelphia, and say, can we help them have better continuity across a geographic area to provide better care for people with complex diseases who are classically underserved. And so the areas that we're focusing on just are substance use and wound care, and most likely sickle cell disease for that small population of people who are just always in the hospital, don't have any continuity on the outpatient side, and I think we really hurt and don't do a great job taking care of. So that's the new thing I'm embarking on, which I could not have predicted 6 months ago. So that is my story. Start my story.
Yeah, so I think, first, thank you all for sharing your stories, because I think I personally know each of you just a little bit, and it's like always amazing to me to hear it. I have so many questions, but I wanted to turn it over to our audience to see, and to you, Angie, to kind of like lead us in conversation with that, based on like the amazing things that we've heard thus far.
So let's open up to the audience. Any questions from anyone here or on screen? I can kick us off while everybody's waiting to warm up, because I know people have a lot to say. So one question that was sent in that I think you guys both can address, and I'll help to address too, is what do you think is one action item that every person in this room or on screen can take to increase diversity in academic entrepreneurship?
I'm going to say intentionality. I think you have to be intentional. So whether that intentionality is in a particular patient population that you want to learn as much as you can about and know what all the right technologies, medications are to treat that, or if it's in a person or persons that you're going to really push forward, or it's in how you are going to promote whatever it is you are doing. But I think you have to be intentional, because I believe that with the intentionality, you are able to get across to people not only who you are, but why you do it. So for me, that intentionality is twofold. It's, I still practice as a nurse practitioner, taking care of kids with very acute complex nutritional needs. And the intentionality around that is because in an inpatient setting, there are not a lot of people on the floors, in the ICUs that really understand nutrition. And it's such a crucial part of care delivery. So that's the one part. The other part is in my role as an educator. I have to be very intentional. I have to make sure, like I went to graduation at Penn last week, nursing graduation, and made sure that I walked up to every student that I had touched along the way and congratulate them for getting there, so that they know that, A, I got my eye on you, what are you doing next? But B, that I have watched what you've done, and you're not just one of a number. So I think it's, for me, intentionality is a way to let people know that you are invested in them, you care about them, and that you are willing to do whatever, to help them move to whatever step they are looking for.
I feel like I need to repeat on the question because I have so many things in my head.
Yeah.
And I want to know how to focus.
It's like, what one action would you suggest that everyone in this room can do to increase diversity in academic entrepreneurship?
Okay, so if I'm going to focus specifically on increasing diversity in academic entrepreneurship, I would say probably first and foremost is always making sure that you're aware of who's at the table and that that in and of itself is diverse. As a business owner, I would always get recommendations for people to be on my board, for CTO, for COO, for any role, and they were always not diverse. And I want to stop saying what I said before over and over again, but it was not diversity represented at all. And the problem is it becomes a cycle that the same small subset of people keep getting referred by the same small subset of people to everybody. And then you just get this, exponential improvement for that one group. And so I had to really be intentional to say, I need someone who fits a different demographic, or at least if you're going to bring me names, I need at least X% of names that are of a different demographic so that we have the opportunity to do that. And that's, it could be as a leader of a team, it could be as a participant of a team and calling out like, hey, we should probably make sure that we widen the representation of the people at the table. I think that also comes into play when you're seeking mentors for yourself, and then also when you're going to be a mentor for someone else and really I think that's, both of you mentioned that, and I think it's so important to really reach out to people who are minorities and underrepresented to kind of give them that encouragement to pursue things that they may not have had other people take. People just assuming like of course you're going to be a leader, of course you're going to do this, and many of us and many minorities don't even have someone making that assumption for them, so they don't make that assumption for themselves. So, with intention, reaching out to people to help bring them up.
I would agree with both of you. I love the word intentional, right? Because you have to be intentional. And for me, I remember what it was like to grow up, not seeing people who look like the person I wanted to become. And so what I take in is I always try to be that change I want to see. I'm going to be that role model. I'm going to be there. I'm going to step out of my comfort zone. And I'm glad I'm here because I heard about the sickle cell interest. So I'm going to network with her, right, to do things to make it happen. And so I would say be that change you want to see. Show up, be there. Many of us go to national meetings all the time. How often do you go to be intentional in meeting other people and inviting them in? Just invite people. You go into a room and like we said, many times you're pushed in the back, or whether it's your race, your gender, your disability, you're just left in a corner. Reach out, be intentional, go bring that person in. And for God's sake, if you have a seat at the table, you have to speak up, right? Like otherwise it's a waste. Why be there if you're not going to speak up? And you don't always have to be the person to speak up. I always tell people, I say, listen, I know I made a difference when I'm not the person who always has to bring up the diversity word or the equity word. I look to the left, I'm like, oh, they caught on. Let them talk, right? Because everybody needs to do that. But don't sit at that table and let something happen and let something go by and you don't say anything. And develop programs. It's great, like the Summer Scholars Program I talked, there are so many things that you could do that just would make it easier for someone else. And it doesn't even cost a lot of money, right? Invite somebody to come in and shadow. Provide opportunities for people. The same thing that you want for yourself, think about how you could do that for somebody else.
I'm going to add to that in that participate as well. Like I didn't develop the Summer Scholar for sure, but I have 2 students that went through that program. One just texted me yesterday, like, I need to talk to you. I'm like, okay, you're 2 years out from this, but okay, but participate, because again, you cannot expect people to be what they don't see. Right? And so they have to see you. They have to see that even the things they don't know about is possible to do.
I'm just going to point to Natalie in the back of our physical room because she is monitoring the virtual room for to engage the audience. So Natalie, I'll turn it to you. Anything that's coming through in the chat?
Yes, we have a couple questions in the chat. So one is, what were the largest gaps in support that you experienced when you were students, and what would have facilitated your engagement with entrepreneurship?
You say it again, I'm sorry.
Yeah. What were the learning gaps in your education?
Oh.
I mean, if I'd like to start specifically on entrepreneurship, I would say everything. I mean, I learned nothing about business. I learned nothing about anything related to entrepreneurship. And that's like one of my soapboxes now is I think all healthcare professionals should learn business, because you said this in the beginning and you said this as well, that nothing, like we can make the best thing in the world. It is not going to get out there to help save lives except through business. And whether that means we're starting the business or we're consulting with the business, we're advising a business, we need to understand how that works. I also think that one of the reasons why clinicians are often not as powerful in decision-making as I think we could be and should be when it comes to healthcare, process and administration, is because many of us don't understand the business economics around healthcare. And at the end of the day, healthcare is a business. Like that's probably one of my biggest learnings from my experience with a startup is it is a business. And my mission could be all I want around saving lives and improving care. If it doesn't make someone money, nobody is interested. So, and it's a harsh way of thinking about medicine, but it's a reality. And so the more we can understand that that is what makes the wheel turn in healthcare, then we can understand how to grease that wheel and we can understand how to get better fitting wheels. But I think there's a lot we need to learn around just business. So if you can take business classes, business electives, in college or in med school, I strongly support MD MBAs, or I don't know if RN MBA, I'm sure it must be a thing, but like any exposure to business, I think is really important.
They didn't plant that prompt, but as the innovation ecosystem, it can, everyone here we're so grateful to spend time today, but is doing other things. And right, it can be a really big commitment to like complete a full program, but there are certificate programs and then self-serving, but the innovation ecosystem is also now offering what we're calling academic entrepreneurship fundamentals, a professional development course. We had the first cohort last fall, and the applications are open for the second cohort, which will be this fall. It's 7 Wednesday afternoons from starting in October, and kind of like start to like just have exposure to some of these words and things. Sharon was one of our faculty participants last time. So, just trying to, again, think about the lowering the barrier for people to find out, honestly, like, okay, now I know about this, but maybe it's not for me, right? But now I know it's not for me, and maybe there's someone else like at this organization who's really excited about this. Like, how do I build a team that makes sense, and to work together, and also to make sure that that team, again, continues to be diverse and represent solutions that are actually going to look like and serve the patients and families that we're targeting. So more information on that coming soon.
I would also, I'm just going to make one more comment too, that some formal training is great, but like everyone said, sometimes you just don't have the time and don't have the money or whatever to be able to do those things. I would look in your environment to find people who can help you, right? So I remember when I wanted to learn more about finances, because I appreciate the fact that many times the reason that physicians don't have the power that they want or need is because the limited knowledge about finance. We never learned finance 101 or understood all the things out there. I went to one of the chief financial officers and said, hey, can I set up some learning sessions with you? I would at real time, let's go through all of these spreadsheets. Let's talk about this. Let's figure this out. And then I would figure out how I could apply that to my own life and my own learning. I have a son who's right now 19 years old in Chicago at a Black sports business symposium. I'm like, make sure you make some connections and connect some of those people to me, because although it's not medicine, it's the same thing, right? They're trying to figure out, how do you manage this? How do you manage projects? How do you create the finances to get things done? You know, even I would say a lot of what we focus on is research and innovation and research. We have to focus on innovation and advocacy as well if pediatrics is going to survive. So part of joining those networks and those organizations, I'm learning so much for that, and what I can do, and the things that I didn't learn in medical school, or I didn't learn with the master's degree and all the classes I've done. I can't be in school forever, but I can take advantage of the things and people around me to push forward.
So you all talked about, you just dove in deep end. You saw a problem, you went after it, you dove in and you went after it, you made mistakes. You all say that. So if you think about it now, what are the lessons you learned from those mistakes so that other people who are diving in deep end and not?
I think one of the big lessons I learned was to ask questions. It's to not be afraid to ask those questions and to sell myself, right? Like what you said about you went and told people this is what you need. I now have the framework. They need me. They just don't know it. I just need to let them know that. And I didn't always do that. Like we talk about imposter syndrome, that held me back from doing certain things and being able to get ahead, not advocating myself and being as assertive as I needed to be. Because early in my career, I didn't necessarily have people who were looking out for me. I had to figure out so many things on my own, right? My parents didn't go to college. Here I am, this girl, inner city Philadelphia, trying to figure out how I'm going to get to Johns Hopkins Medical School, right? A lot of mistakes, a lot of things I just didn't know. I had to figure, and I faked it until I made it. But there were certain things I'm like, God, it would have been so much easier if I had just asked this one person this one thing. But at the same time, I have to recognize what I was up against at that time. Right. And so I think through all of that, one of the lessons and things that I built was resilience and just not being afraid. It's hard to say that, but now I'm one of those people where I don't care. Like, hey, if they tell me no, I didn't have it anyway. So don't be afraid to ask. Right. It has completely changed who I am through those experiences. But yeah.
I would say, I like that question, right? I would say that recognize that you're going to make some mistakes. Like, it's not going to be smooth by any way, shape, or form. But building off of what both of you said, as you are going through, build your village. Build your village so that you know who you can call. Like from the time I met Angie, I was like, oh, I need to know her.
Here.
Right? And so there definitely are times that I will text and be like, I need my Angie time. So build your village because you are going to make mistakes. Because nothing's perfect. At the same time, I think be, assertive in your own knowledge, right? So what I mean by that is when I started doing inpatient, acute and critically ill education, the theme was, we'll feed them when they get better, okay? Well, they're not gonna get better if you don't feed them. So this is a problem for me, and so I really had to, I probably have more nutrition books than most nutrition professors, okay? I now teach nutrition, but at the time I didn't, but I was buying and I was looking up everything I could so that I could ask the intelligent questions of those people. Like you were saying, you didn't know some of the words. Well, people would say things like macro and micronutrient, and I was like, what's the difference? At the time. And so I did some of that self-teaching, but not being afraid to ask those questions. And when I say build the village of the people that you are okay to at least get those initial questions out, and then they can direct you. But now you feel better, right? Because they're like, oh, I asked Angie this, and she didn't say, go home, girl, like she said, I can give you this much, I don't know all of it, but, like, I'm gonna introduce you to Lauren to say, like, how do I take this to the next step, right? Those kinds of things, I think, are.
Yeah, I definitely agree with both of those. I also love that you said, accept that you're going to make mistakes. And I like to think of them as just stepping stones to success. And so that's okay. They're necessary. One of my biggest lessons learned is I don't know what I don't know. And so I have to seek advice from as many people as possible. I think of it as doing diligence at any important decision. So, before I decided not to do fellowship, that was a smaller one. I went to my program director and a couple other people. When I decided to start the business, that was a big one. And so I talked to someone who started a business and left medicine, talked to someone who did an MD, MBA and was doing business. I talked to another person who created something, but then let someone else take it to market. And he stayed as a scientific advisor and tried to really get the gamut of different advice on whether I should even start the business or not. But then there's also who should you start it with? Who should your partners be? Doing diligence on anyone that you work with, meaning actually find out from other people about the people you're about to go jump off a plane with. So, and there's so many things I would do differently had I done more of that when I started. So, with the nonprofit, I have to kind of rein myself in because I want to boil the ocean, but I've stopped myself and said, okay, I am in an information gathering phase. Before I jump in and start, even though I already think I know what I want to do, I'm going to take the time to talk to as many people as possible and build this network and understand what do I not know about this new space that I'm working in and where can I be most impactful. So, so one of the things you said, now learning is so available, right? You can find information anywhere. So whether it's YouTube or ChatGPT, there's a lot of different places where we can easily get information.
That's great. Sorry.
With that, your due diligence to make sure the information you're getting is correct.
Absolutely.
I think about my summer intern that I had 2 years ago. This was when infant formula shortage was happening, and there was a lot of stuff, right, everywhere, newspapers, internet, this, that, and the other. And initially, one of the things that we did was we spent a lot of time with 2 different librarians to understand how to identify the right websites, how to identify what's junk and what's real, right? And at first, she was kind of like, because her friends in the program were in labs snapping rat heads, right? And I was like, I'll do it. Okay? Right? I said, but you're going to get a lot out of this, and you are going to understand this. And by the end of it, you could just see the pride in her that she understood and could tell even her friends, don't use that website. And here are the reasons why, right? But this one is a good one, right? Because she could now pick out, is there an author? Is there a date? Is there some of the nuances as to what's a good one and what's not a good one? So you have to do your due diligence to make sure that the information that you're gathering is correct.
Well, I want to thank you all for these wonderful insights. And I also want to acknowledge that it's 1 o'clock. So for the virtual people who are attending, I want to thank you for participating. You guys can't see it here, but I'm advancing the slides here for the people who are joining virtually. We're going to move to more conversation to continue for those who are here in person. But want to thank people who were able to devote some time today to join us virtually. Remind you about the academic entrepreneurship class this fall that I mentioned briefly already, that the innovation ecosystem team will be conducting 7 Wednesday afternoons starting in October. There's an application and information, so please check that out. And then also just greatly appreciate your attending, getting the system reboot, because there's critical security patches. Thank you, technology. And for those of you joining us online, you'll see shortly a poll in the chat to give us feedback on the session. Like you've heard from our speakers here, we're always eager to continue the journey, continue improving. And so want to thank you for joining us electronically in the virtual space. And we hope that you will be able to join us at a future event so we can spend more time together. So thank you to those joining us online.